I'm a coordinating investigator for Boehringer's Phase 2 program evaluating BI 655066. It is a monoclonal antibody targeting P19, which means it inhibits the activity of interleukin-23. The standard that we see for this characteristic, or populations that are characteristic of this program, so that we're looking at adults with moderate to severe plaque psoriasis defined by body surface area of at least 10%, PASI at least 12, and a PGA of at least 3. PASI is a score that is used to evaluate the clinical signs of psoriasis. So it's a composite measure involving the body surface area as well as the severity of the individual plaques. It ranges from a score of 0 to 72. Most patients or the average severity of patients in this particular cohort was a PASI 20. The overall goal of this molecule is to block, in blocking IL-23, that you can see improvement in clinical manifestations of psoriasis. It's highly effective. We see that with a single dose of 18 milligrams administered at week 0, we get responses in terms of signs and symptoms that are comparable to ustekinumab administered according to label at week 12. We see that with the 90 milligram and 180 milligram doses administered at week 0 and week 4, clear superiority in terms of efficacy compared to ustekinumab. What we saw was a very remarkable response with almost 100% of patients showing at least some response at the higher dose levels, and very robust responses at PASI 75, at PASI 90, and at PASI 100. We can't say how dramatically it will change their lives until we actually proceed with the full development program. But having a treatment option that provides the clear benefit that we've seen to date is extremely promising. It's a very, very, very remarkable response. What is perhaps not surprising but very gratifying is that the adverse effect profile was actually not remarkable at all. We saw very comparable event rates across all the dosing arms, and very low rates, meaning that so far, at least in a small study, there's nothing to suggest significant safety signals. But further programs, obviously, in larger numbers of patients will have to be observed. But it's at least with the limited data set we have, there's no suggestion that there is a clear drug-related toxicity. I think there are numerous decisions to be made, including what is the best dose to move forward in, what would be the best dosing regimen, and that's something that will be evaluated when the full data set is available.